Thank you. So welcome to the March session of Breezing Along with the RML. Like I said, today's session is recorded and will be available online for future viewing. One note for those here in the room with us today, that when you do leave the meeting, you will be prompted to fill out an evaluation. So if you could just take a few moments of your time and do that, we would really greatly appreciate that. So I'll try to do one more reminder at the end as well, but we'll see if I recall to do that. So my name is Chris Pryor. I am the Library Engagement Missouri Coordinator for the MidContinental Regional Medical Library. And I'm really excited to be here facilitating this session today, as we are here with two of our Professional Development Award recipients that attended the ALA Midwinter Conference in Seattle. So we have Robin Newell, who is the Executive Director at the Emporia Public Library in Emporia, Kansas. And we also have Levi Dolan, who is a Graduate Library Assistant at the University of Missouri Health Sciences Library. So we're going to be hearing their stories shortly about their experience with attending Midwinter and the pre-conference that we all went to. So just to give you a brief agenda of kind of what we're going to be doing in this session today. So again, just a brief overview of that pre-conference, and then we're mostly going to hear about Robin's and Levi's experiences during that Midwinter conference, and then we're going to have some Q&A. So if you have questions or you want to hear more about a specific topic as we're going on, please do put your questions in the chat. We'll be taking those as we go through the Q&A at the end of the session. So just to put up a group photo, so this was our group, our cohort that attended the ALA Midwinter Conference and pre-conference. So this was our 5 awarded Professional Development Award recipients, along with myself and our Wyoming coordinator. We were all in attendance of that. So we decided to take a little group photo, so we have this memento to remember that day by. So I just wanted to share that with the group today. And this was the agenda from that day. So this funding opportunity that we offered through the National Network of Libraries of Medicine, MidContinental Region, was for these recipients to attend this pre-conference, which was Implicit Bias, Health Disparities, and Health Literacy, which was offered at ALA Midwinter in Seattle. This pre-conference was sponsored by the National Network of Libraries of Medicine Pacific Northwest Region, the Public Library Association, and the ALA Office for Diversity, Literacy, and Outreach Services. So this is a copy of the exact agenda that we went over that day, and it was packed with a ton of great information. This was just a half-day pre-conference, but it was interactive. It had presentations. We did facilitated table discussions and self-reflection, all within that 3-4 hours time. And the MCR group that you saw in that previous photo decided to take it, to keep that conversation going after the pre-conference. So we all decided to go have a nice, relaxing lunch together after the fact, which really gave us a nice opportunity to hear about the discussions that were going on at other tables, because none of us were sitting at the same tables together, but we also just got to know each other a little bit more, and networking is always a great part of any conference. So I just wanted to take this opportunity to share the objectives from the session. I'm not going to read these off because I know it's a very long, wordy slide. So I just wanted to share those objectives with you so you could take a quick look at those. And then how we met those objectives were just a great lineup of speakers throughout the morning. So we started off the morning with this fantastic keynote titled Implicit Bias and Health Disparities, which was delivered by Dr. Kimberly Reynolds from the University of Miami Miller School of Medicine. She's a board-certified pediatrician who has really dedicated her whole life's work to improving the lives of children in South Florida. She had us doing a lot of really great activities and really thinking a lot about ourselves. And I'm not going to steal Robin or Levi's thunder here, so I'm going to stop at that point there. And then we had a session after that wonderful keynote where there was 2 sessions about health disparities and community interventions. So we heard from Dr. Linda Coe from the University of Washington Health Communication Research Center, where she really spoke to the group about the importance of user-friendly communications, especially when working with vulnerable communities. And then we also heard a presentation from Eileen Rupert from the Spokane County Library District. She shared her library's experiences about developing partnerships to support and address community health needs. And to finish out our morning, we had a session on empowering equity, what health literacy got to do with it, which was delivered by Michelle Spates from the National Network Library Medicine Pacific Northwest region. And then we finished out our morning, concluded all of that with facilitated table discussions, which were led by Jeff Turner from Praxis HR. Jeff actually facilitated the sessions all morning, so he really kept us moving and making sure that we didn't get hung up for too long. But this was really a period of self-reflection that then moved into small group sharing that then really led into a larger group takeaway section. So at this point, I'm going to turn over the session to our pre-conference attendees. So we'll start off with Robin. So take it away.
Thanks. So I'm just going to tell you a little bit about how I came to be at the conference, really. About a year ago, our library received a wellness grant for staff wellness within the library. And this really changed my way of thinking about health literacy as far as in a community setting, but also within our library. And anyway, I started thinking about that, and I saw the notice come out to be able to attend the Medical Library Association's Public Library Symposium that they had in Atlanta. And I thought, well, that sounds interesting. That might work well with this grant that we have going to get some more information and to make some more contacts. So I applied for funding for that and got that. And that was a great experience. It was 2 days of very intense learning, lots of networking, and I'm still running into people that I look at and say, weren't you in Atlanta? Or were you in Atlanta? And they have made great connections there as far as working within the field and additional information. So I went to that. That was where I heard for the first time about the All of Us project and learned about precision science and just like I said, it was 2 days of real learning for me as a public librarian. I'm not a medical librarian. I don't have that in my background, so there was lots of information given there that was really interesting to me. I was especially intrigued with the All of Us project and continued after the symposium to stay connected with the people that were responsible for that. And those conversations led to us being included on the All of Us project educational tour, which is going across the United States, or at least going across Kansas, which we're really excited about. And they're actually going to be here in Emporia, in the Emporia community in April of 2019, and for our Cinco de Mayo celebration downtown. Now, if you haven't heard of the All of Us project, please go to the website. It's the NIH website, and just search for All of Us, and there's a ton of information there. It's really exciting to see this, like I said, nationwide project to gather more data so that people can be healthier, so that our communities can be healthier. So once I had been to the Medical Library Association symposium, like I said, there were just lots of ideas that I had as far as I knew that the Public Library and Medical Library Association wanted to work closer together. So I started making those connections, again, here in the community with the All of Us project, but also when I saw the ALA Midwinter pre-conference on implicit bias, I thought, well, that looks really interesting because number one, I don't have a clue what implicit bias is, so it would be a great learning opportunity for me. And again, it was going to be another one of those opportunities to connect with other people in the medical library profession and with the public library profession. So went to that, and that funding allowed me to, number one, go to the pre-conference, but it also allowed me to attend Midwinter, which I am very appreciative of. So that's kind of how I got to where I'm at today. I will have to say that going to the pre-conference on implicit bias really informed my learning at Midwinter. As far as many of the sessions that I went to, I could tie directly back to this pre-conference, whether it was on diversity, whether it was racism, whether it was being mindful. Many of the sessions that I went to, I could tie right back to this pre-conference. So it really informed kind of my way of thinking all the way through conference, which was kind of neat to be able to make, again, those connections. So just a little bit about the pre-conference. If you'll go to that next slide. So this was probably my biggest takeaway from the pre-conference, and what implicit bias is. And implicit bias is internal biases that we don't know we have. They're in there, and we just don't realize it. And the way that the author of the book Blind Spot demonstrated that, and the authors are Mazarin, Banaji, and Anthony Greenwald, but the way they demonstrated these internal biases and the way our mind can kind of play some tricks on us is they use these two tables. And these two tables, they put them up and they say, now, when you look at these two tables, they don't look the same size. And to me, I totally agree. They don't look the same size. And then the author or the people at the conference went on to show that indeed these tables are the same size. And it's like, I accepted it at the pre-conference and thought, well, okay, I get this. But I actually, when I got home, I traced the tables out of the book, cut them out with paper just to make sure, because I still couldn't convince myself that these two tabletops are exactly the same size and exactly the same shape. And they're called mind bugs because there are things in our brain that, because of the way we developed in a 2D world, that our world is now 3D, or I'm not sure which one of those was correct, but our mind simply can't wrap around that some of the optical illusions, and it has nothing to do with the way we think, because I know from experimenting that these two tables are exactly the same size. But I can tell you right now, when I'm sitting here looking at them, they are totally not the same size. So there's something in my head that's not working correctly, and that's called a mind bug. And implicit bias is the same way. It's something that we are not aware we are thinking, even though we are thinking it. And there's a test that Levi is going to talk about later. It's called an internal bias test that you could actually go on and test online. And it really struck me when I took the test. And actually, they warn you not to take the test if you don't want to know the answers. But it really made a huge difference in my perception of how I am with other people, including my patrons and including those that I'm talking about health literacy about. So a lot of the information that came out of the session was about how our minds work to kind of play tricks and make us think that we're being fair when maybe we're really not being fair, and how that unfairness of treating individuals, especially our library patrons, with health literacy information can cause us to not deliver the best services that we could. So again, a great a great opportunity to really learn something new and to make myself more self-aware as a librarian and just as a human being. And again, it really expanded my my way of thinking about how we not only provide services in health literacy, but how do we provide services in many other areas in public libraries. So next slide. So this is the book, and I have to tell you the story about the book because it's just funny. So at the end of the pre-conference, they're all sitting around the table, and you know, it's door prize time, and I love prizes, so I'm really excited. And they say, okay, look under your chair. And so everybody looks under their chair, and of course I don't have it, and that's okay. And somebody else has it, but they already have the book, and the other person already has the book. So they're kind of handing this book around saying, you know, does anybody want this book? And I'm like, you know, I had never heard of the book. I'd never read the book. And I thought, well, that might be nice to put into our collection. So at that point, I said, yeah, you know, I'll take it home and put it into the collection. And I'm telling you what, I started reading it on the way home, and it made so much more sense. It's just like the pre-conference cracked my brain open, and reading the book really, really made a huge difference in the way I think about the services that we provide in our library. And it is hidden biases of good people. It's not saying that there's anything wrong with this. It's just saying that we've got those things in us, and we need to be mindful and aware of the internal biases that we may harbor. So, you know, a great pre-conference, tremendous learning, certainly will inform the way that we continue to provide services, not only in this public library, but I will tell you that we're working with a Kansas Health Foundation right now, the Kansas Library Association. They're going to be sponsoring our library conference as a partial sponsor. So we're really reaching out into the health world in a way, as a library, a public library, and as a library organization, to make those connections. So I have to just say thank you to the National Institute of Health and to the Mid-Continent region for providing that funding, because I will tell you that journey that I was on has continued beyond the pre-conference and will continue. So I'm really looking forward to see where it's going to be taking me personally next, and librarians across the state of Kansas. So thank you very much.
Wonderful. Thank you, Robin, for that great report. And I'm so glad to hear that your journey is continuing as you go beyond the pre-conference. So now we'll turn it over to Levi and hear about his takeaways. So let me get to his slide. Unless, Robin, did you have anything else there you wanted to add? I just realized you had another slide in there.
Yeah, I was going to just say that, you know, again, my takeaways were that everyone has implicit bias, whether we know it or not. And it can be very disturbing to think that, it's not disturbing, but to think very noble of ourselves and realize that we do have that bias in us. That the implicit bias is hardwired into our brains. It comes from hundreds of thousands of years of being able to look at someone and say yay or nay, and that implicit bias does keep us sometimes from doing our best work, which was the whole reason for the pre-conferences. Are we keeping ourselves from reaching the people that need us the most because of biases that we have internally? And then what's next for us? But thank you.
All right, awesome. Thank you. Sorry to cut you off a slide early there. But we appreciate that. So now we'll turn it over to Levi.
All right. So my name is Levi Dolan, and I am a library and information science student at the University of Missouri, and I'm the grad assistant at the University of Missouri J. Otto Lotz Health Sciences Library. So I had joined NNLM last fall, just as thinking about how can I learn more about what's going on in medical librarianship and things related to that. And shortly after, I heard about the professional development opportunity, and Chris Pryor did her job, and she engaged me, and I decided to apply for it and go. And I do want to communicate that I'm just really thankful to the National Institute of Health and NNLM for the funding opportunity to attend. I would not have been able to do it otherwise as a student, and I did learn a lot from it. So I just have one slide for us today, and these are summarizing questions that I am now asking because of what I learned through attending the pre-conference. And they're kind of like looking at pulling together things that we talked about and how it's now in my mind and in my awareness. The first one, tying into a lot of what Robin said, is how does my personal bias influence my service to library patrons? And you know, as a library student, we, I think, are pretty aware that we have biases of some kind, that everybody might have some type of bias, but we also aspire to reach beyond that, and professionally we are, you know, being taught and learning as baby librarians that we want to give the very best access and the very best service to everyone, no matter where they come from or how they phrase a question or what feelings we might have about their question. So definitely, you know, as I'm learning as a student about the Library Bill of Rights and how we have the idea that we're going to embrace equity and inclusion and diversity, I definitely know that is a value of librarians, and that's one thing that, you know, is attractive as wanting to be a librarian, is you want to be that kind of person. You want to provide a high level of service, but many of the mechanisms that we're taught for how to do that are very focused on exterior forces, and are focused on circumstances and things that we can do in providing service, such as, you know, building our collections to reflect diversity or collaborating with outside groups. So for me, the pre-conference, I was really appreciated that it provided a space for us to examine internally how might our biases have some outward effect in actions with that we hadn't really thought about. And the tool that Dr. Reynolds pointed us toward was this website, implicit.harvard.edu, which Robin mentioned also. And it's just a site that you can go to and take little short 5-minute tests for different groups of people, being focused on different groups of people, and just see what it tells you about your implicit bias. So a bias that you don't feel aware of and you don't necessarily think about, and hopefully you know, is something that you overcome as you serve people, but also just to build your awareness that can factor into your process without you even understanding it. And I did go to the site, and I took a couple of the tests, and it's not a fun thing to do. You don't feel like awesome about you know, seeing that you're not 100% neutral person who has nothing that could ever be considered a bias, because that's kind of what you want to feel. You want to feel like you're not the person that this is really for. But all of us have something that we can improve at, or at least whether or not we can change that in ourselves, we can at least build an awareness that is in us. And that's what I took away from the implicit bias part of the day, was just to make that a component of being a librarian, just being aware of how my implicit bias might influence how I serve people. And then as we moved from that into talking more about health literacy, especially I took from Michelle Spatz's portion of the day. She talked about how important health navigation is becoming, and that leads me to that second question: are health navigation resources improving in my library? And I think this is a question I will, be thinking about as a student and in any library that I work in. That we can have some kind of input in this because this is an area that's growing in a need, because people are being asked to navigate more and more for themselves things that are pretty complex that relate to them being literate for their own health and for the health of their families. And as a library student, we often are asked to sort of envision or address how libraries are changing, the directions that they may be going, and this is definitely a way that we can see a need growing, and we can see a need for libraries finding ways to address it. So I felt, especially from hearing Michelle Spatz talk about that I could see how that's a really concrete way that or area that libraries need to find ways to be involved in. And she used the example of the health literacy paradox. She talked about that term as a way to think about it, and her meaning was that in the culture there are many informational inputs that do not encourage you to increase your health literacy or to improve your own health, whether it's junk food ads or just the way that we're asked to manage our own health. And so but at the same time, we need to improve at using those tools if we're going to actually improve our health. So that's something I saw through attending this, is just seeing, oh yeah, lots of different libraries need to be involved in this. And then lastly, because I had a good experience, I am definitely thinking more about who can I involve in medical librarianship opportunities. And that is partly just because of the nature of the pre-conference. It involved not just the National Network of Library of Medicine, but also the Public Library Association, and which is a part of ALA. And so just seeing that collaboration encouraged me to think that, hey, my classmates could also benefit from this type of training, because whatever type of librarian people wind up becoming, there's a place for health literacy in many types of those jobs. So I've talked to 3 people since going to the pre-conference just about how that can maybe be a part of training as we're getting ready to be librarians. So that is something that I was encouraged to do because of how well practically just the institute was run, and Chris Pryor and Suzanne Sawyer communicated with me each step of the way. And you are asked to do a lot of different kinds of things, or invited to participate in different things as a student. But if you find something that's run pretty well, that can definitely be an attraction. And I hope that some more students will find these opportunities, because I found out about just more ways to think about health literacy and how it could be involved in libraries going forward. And I also, it was the first time I heard about the All of Us initiative, and just having that as a place to point people toward in the future was really valuable to me. Michelle Spatz also talked about this Health Literacy, The Solid Facts, which is a book by the World Health Organization. And that's something that I had not heard of either, and it helped me to have kind of a context for how to reference some of those things. So yeah, for me, it was a lot of new information, and I was just encouraged by seeing the collaboration among everyone, and you know, just looking forward, seeing that this is really an essential issue that affects everybody, because we all are going to have health concerns, and we all are going to need to, you know, we all are going to want to give the best that we can for ourselves and our family's health. So I just seeing how that involves whether or not we find a librarian or we find an information resource that really gives us the best information and the best service is something I will be thinking about, because I attended this. So I really want to thank everyone just for being a part of this, and I'm just so glad that I could have the funding and be able to attend it. So I really appreciate it.
Wonderful. Well, it's great. Thank you, Levi, for that report. It's great to hear these two very different stories, and the similarities that you guys picked up on through the course of the day, but the differences as well. So at this point, we're going to move into our continued discussion. So if anyone who is attending, if you have any questions that you'd like to ask the presenters today, please feel free to type those into the chat box. So we will continue our discussion here. So I'll start it off with a question. So, what do you both think it would take to create some change on this issue, the health disparities and the implicit bias?
This is Robin. I think it's going to take some education, and I think for myself, the more staff members, the more library staff members that understand about implicit bias, I think that will help them as they go forward providing service. So I think it's going to take some education. I think it's going to take time to make progress on this. And I think it's going to take a ton of collaboration, which I'm just really excited to see medical collaboration with library collaboration. And I guess I'm speaking from my public library lens, where we just have to be really intentional about reaching out to organizations in our communities like ours is Healthier Lyon County, about saying, we're here, we want to help, you know, how can we collaborate together to make this a healthier community? So those are my thoughts.
Yeah, I agree. For me also, it felt like being introduced to the topic just made me see like there's a lot more education that could be involved for me to benefit from personally, but also just thinking about how it could really change in our world. I think just finding ways to link together that information that we're learning and the things that we have, and hopefully find some of the areas where that may be something that could be focused on the most, maybe areas where we do identify that disparity in health outcomes, and finding what libraries are in those areas, or how we could raise awareness in kind of the hot spots where we might see that happening might be a way to just find the places where we can do the most good.
Great. Thanks you for answering that. We do have a question from John in the audience about what ideas do you all have for integrating these concepts into library programming? And a follow-up to that, or whose voices need to be added to the conversation in regards to improving your library programming?
This is Robin. As far as what ideas do I have for integrating these concepts into library programming, for me it's really, my focus is going to be making sure that the information gets presented at our state conference, and making sure that they understand that there's more of a connection with the National Institute of Health and the National Network of Library of Medicine than there has been, and why it's crucial now. I mean, when we've got people overdosing in our libraries, we've got people with health issues that we see every day in our libraries. To me, this has just opened up a really great door to more conversations between public librarians and medical librarians, and just in general. And as far as whose voices need to be added, who's not at the table, I think those conversations will start happening as librarians go out and participate in community activities, whether that's library programming, or whether that's outreach programming, or whether it's simply a conversation maybe at a service organization like Rotary or Lions, but where we start to talk about health literacy and what libraries can do to improve the quality of life to people who live in our communities, and what that can mean for our economy, what that can mean for, I mean, it's just like I said, I think Levi said something about, it opened the door, and it really opened my eyes to a whole nother way of thinking about health literacy, and the way we present it, and the way we collaborate or don't collaborate. I mean, we can bring the doctor in or the nurses in and do the diabetes programming, and a lot of libraries do that. But I think for me, it's going to be more intentional and really trying to work one-on-one to make some differences with the other health organizations in our community.
Yeah, for me, I'm going to be doing a presentation at our student conference where I'll talk about some of these things that I've learned and hopefully add to them a little bit, which will be next month. So I guess my idea right now is to just try to widen the awareness among future librarians that are my classmates. I think, like Robin said, just the idea that this could be a way for people that are going to be public librarians or a variety of academic librarians or school librarians could still find something that would be beneficial to what they are going to do. I'm hoping that will be a way to eventually help that be involved in the programming at their libraries that they go to.
Great. I just see that some work came into the chat. So Michelle Stotz from the PNR is here with us today. And she's so thrilled to hear how the pre-conference with PLA and the Office of Diversity had such an impact. So just a note to let you know that we are continuing the work with PLA to offer a podcast with Dr. Reynolds, wonderful, on implicit bias, and later a webinar on health literacy and health equity. We didn't want this pre-conference to be a one and done, so that's the follow-up programming. Wonderful, Michelle. I know we are all excited and thrilled to hear that that this will be continuing, because it had so much impact, as we're hearing from two of our attendees. Any other questions coming from the audience? Just checking. Thank you, Michelle. I'm so glad you're able to be here today with us, Michelle, to chime in and to hear about how the pre-conference went for us here in MCR. I'm not seeing any questions from the audience, so I'll go ahead and ask another one. So thinking back to your last discussion there, do you have any ideas about how we could inspire more of that collective purpose around health literacy? You talked a little bit about programming and things like that, but you know, what can we do as libraries and librarians and staff in public libraries or any kind of library to really inspire that?
This is Levi again. Thinking about what Robin said, I know something for me that's kind of solidifying is that with the All of Us initiative idea is that kind of no matter who we are, you know, this is a topic that is going to affect our lives, and hopefully we can see that as something that would bring people together or help there be a commonality in terms of saying, yeah, you know, I may get blank out of my library, but I definitely am going to have to go to the doctor someday, and I would like to know how to do that and where to go and addressing different kinds of health concerns in my life. So I think maybe just like seeing more and more how this could be a place for people to turn and making that connection to me is the way that common purpose could be built.
This is Robin. So when I came back and I gave my report to my library board about the pre-conference and specifically talked a little bit about implicit bias, I have a physician on my board, and he said, you know, that's very interesting. Perhaps you could teach me something. And that really struck a chord with me, that I brought something back from a conference that a doctor would say, you know, perhaps I could learn something about implicit bias that would improve my practice. So for me, it's those one-on-one conversations, and I was in a training last week in Wichita, and the head of pediatrics at KU Med was there and taking the training with me, and I spent 2 days worrying about whether I should show him the blind spot book, and I finally said I can't stand it, so I took the blind spot book over, and we had a nice little conversation about what it was and what I had learned and medical literacy, and it was a really great conversation because there were also other individuals there from other professions, and so for me it will be having those kind of community conversations about, you know, this is health literacy. We know everybody's struggling with it right now. How can we make it better, and how can we get over our internal biases that we don't even know we have to do so? So that's my thoughts on it.
Fantastic. Wow, that's great that you got to have that interaction with a physician on your board, no less. So that speaks volumes when you get the opportunity to teach them something as well. So just checking the chat to see if we have any additional questions coming in from our audience this afternoon. Not seeing anything right now, so I'll go ahead and ask one more question. So what do you both think is our next level of thinking that we need to do on this? And where can we go?
I guess for me, just that kind of day-to-day idea that I have now is to, you know, have more awareness just about how my personal implicit bias can affect my actions with people that come in and ask questions at the service desk. And I think even talking to some of my classmates about this a little bit, it's encouraging to think about a way just to have more of a vocabulary for how to talk about implicit bias is really valuable, and like Robin said, maybe just having those conversations with people is a way to communicate that and to create that space for someone else. So beyond that, just I think looking at the All of Us initiative, there's a lot of different ways for us to look at being participants in it, and I hope that going forward I will keep finding a way to be involved.
So this is Robin. For me, it's going to be getting the people that could use our services involved in conversations about how we are providing our services, and what would it look like to them to have better services from the public, better health literacy services from the library. You know, what are their needs? So that would be, you know, engaging maybe in a community conversation about it, maybe some one-on-ones with some patrons who are willing to share. So that would be my next level, is actually engaging with the people who we are trying to serve, and having intentional conversations about what would it look like for you if this was done in a better way or a different way, or you know. And one of those examples for me is we don't have live chat. You know, maybe they'd feel more comfortable talking in a chat window to somebody about a health problem than a face-to-face situation. So it's just it's those questions that I have right now that I'm curious about how we can better serve them, and I'm looking forward to having some of those conversations.
Great. Robin, I actually have a follow-up question for you. So you mentioned how you've shared this with your board, and how you're thinking about how you want to shape and mold this information for your community. But just curious about if you've done any information sharing with your staff yet about this, or educating them on implicit bias and health literacy, or is that something that's kind of that future goal?
It is the next. Right now our library staff are reading the Ryan Dowd book, Librarians for the Homeless, and I probably didn't say that title correctly, but we're reading through that. So the blind spot will be the next book that we take on as a staff, and we'll all be reading that and having discussions about that. But yeah, and I've had the situation with the library board was I gave my report out, and then it was picked up by the local newspaper, and they had about a half-a-page article about implicit bias and what it was. So they really did a lot of informing there. So that came back because people saw it in the staff members saw it in the newspaper and came back, and we've had a couple of short discussions about that. But I really want them to read through the book, and if they are comfortable, at least take a couple of the implicit bias tests, because that, like Levi said, you want to tell these noble stories about yourselves, and you know that you want to be equal to all. And I am a huge believer in the ALA Library Bill of Rights and the principles, and so when I see that maybe I'm not as noble as I think I am, it helps me understand how to get over those hurdles and provide better service. So yeah, we will be doing the blind spot book.
Great, fantastic. Just checking to see if we have any more questions. We have a few minutes left. If anybody has anything else they would like to ask our presenters this afternoon.
Hey, this is Robin again. I just want to echo Levi and say thank you very much again for the funding and the opportunity to learn all this information and to share it out and really make some changes. So again, thank you very much, everyone that was involved with this process. Like Levi said, Chris helped walk me through the process. There were lots of other staff that helped with details, and so I really appreciate the process to get the funding and to be able to make the trips.
Wow. We are glad to do it here at the NCR and happy to have the opportunity. I was happy to be there with you at that opportunity and get to discuss this more with you and prepare for this talk. So it kind of all came rushing back as we were getting ready for this. It's hard to believe that was 2 months ago almost. So where has the time gone? So I'm not seeing any additional questions. So at this point, we'll start to wrap it up for today's session. I do want to thank you all for coming out and joining us for this session. As I mentioned, it is a recorded session, so it will be available online. I do want to mention that you may want to check out our upcoming newsletter in April, because we're actually going to have an article in that newsletter from 2 more of our Professional Development Award attendees for this pre-conference. So there will be their take on the session in our newsletter. And then the 5th person is actually going to write a blog post for us. So that's going to be her perspective on this. So we'll have some more content about what the takeaways were from those 3 individuals in our upcoming newsletter and blog post. So with that, just one more reminder that when you do leave the session, you are going to be prompted to fill out our evaluation for this afternoon. I hope you will take a few moments and do that. We do love to receive your feedback. But I hope that you found this session helpful, and I hope you all have a great rest of your day. And I want to thank you, Robin and Levi, for doing this and joining me on this journey as we've been through this. And it was a great time. I really enjoyed getting to know all of you better as well. So we'll go ahead and start closing down the room, and I hope you all have a great rest of your day.